Hey everyone, and welcome back to the channel. Today we're going to talk about something really important that affects millions of people worldwide. HIV, you've probably heard of it, but there's a lot of misinformation out there. So, let's clear things up and talk about what HIV really is, how it's transmitted, and most importantly, how we can protect ourselves and support those living with it. First off, what does HIV stand for? It stands for a human immunodeficiency virus. The key word here is immunodeficiency. HIV is a virus that attacks the body's immune system, specifically the CD4 cells, which are a type of white blood cell. Think of these cells as the soldiers of your immune system. They fight off infections and diseases to keep you healthy. When HIV gets into the body, it starts to destroy these cells, making it harder for your body to fight off even minor illnesses. If HIV isn't treated, it can eventually lead to AIDS, which stands for acquired immunodeficiency syndrome. AIDS is the most advanced stage of HIV infection. This happens when the immune system is so badly damaged that a person becomes vulnerable to what are called opportunistic infections. These are infections that a healthy immune system could normally handle without any trouble. So, how does someone get HIV? This is where a lot of myths come from. It's crucial to know the facts. HIV is primarily transmitted through specific bodily fluids: blood, semen, rectal fluids, vaginal fluids, and breast milk. It is not spread through air, water, saliva, sweat, tears, or casual contact like hugging, shaking hands, sharing toilets, or sharing dishes. You can't get it from a mosquito bite either. The most common ways HIV is transmitted are through unprotected sex with someone who has HIV and by sharing needles or other drug injection equipment. It can also be passed from a mother to her child during pregnancy, birth, or breastfeeding. But with modern medicine, this is becoming increasingly rare. Now, here's the good news. Living with HIV today is completely different than it was a few decades ago. Thanks to incredible medical advancements, HIV is a manageable chronic health condition. People with HIV can live long, healthy, and fulfilling lives. The key is a treatment called antiretroviral therapy, or ART. ART involves taking a combination of medicines every day. These medications work by reducing the amount of HIV in the body, which is called the viral load. When someone with HIV takes their medication as prescribed and their viral load becomes so low that it's undetectable in a standard blood test, they have reached what is called an undetectable viral load. And here, the amazing part. A person with an undetectable viral load cannot transmit HIV to their sexual partners. This is often summarized by the phrase, undetectable equals untransmittable, or U. This is a game changer not just for preventing transmission, but also for reducing the stigma that people living with HIV often face. So, how can you protect yourself? Knowledge is power. Using condoms correctly every time you have sex is a highly effective way to prevent the transmission of HIV and other sexually transmitted infections. For people who are at a high risk of exposure, there's a prevention method called PrEP, which stands for pre-exposure prophylaxis. PrEP is a daily pill that can reduce the risk of getting HIV from sex by about 99%. If you think you might have been exposed to HIV, there's also PEP, or post-exposure prophylaxis. PEP is a course of emergency medication you can take within 72 hours of a possible exposure to prevent the virus from taking hold. Getting tested for HIV is also incredibly important. It's the only way to know your status for sure. Testing is simple, quick, and confidential. Knowing your status allows you to take control of your health, whether that means starting treatment if you're positive or taking preventive measures if you're negative. Finally, let's talk about stigma. The fear and misinformation surrounding HIV have created a lot of harm and discrimination. It's so important that we treat everyone with compassion and respect, regardless of their HIV status. People living with HIV are not defined by their condition. They are our friends, family, partners, and colleagues. Educating ourselves and others is the best way to fight stigma and create a supportive community for everyone. If you have questions or concerns about HIV, don't hesitate to talk to a healthcare provider or visit trusted websites like the CDC or the World Health Organization. If you're feeling overwhelmed or need someone to talk to, there are mental health resources and support hotlines available to help. You are never alone. Thanks so much for watching and for taking the time to learn about this important topic. Let's continue to spread facts, not fear. If you found this video helpful, please give it a thumbs up and consider subscribing for more content. See you next time.